Today's Wheelie Good tip is brought to you by Access Community Health. Thanks guys for your support.
Why do you need a GP? So interestingly, not everybody has a GP, so it's really, really important that you have one before you leave the spinal unit. Your GP will be your go-to for prescriptions, any medical advice, any future referrals. They'll be the person that you need to go to when you do have an issue, obviously, as anybody would for going to visit a GP. It's just really important to get one before you leave. The best time to see your GP is 2 to 3 weeks after you get home. The reason for that is your prescriptions have usually run out by sort of 3 to 4 weeks after you go home. Also, you'll be able to see your GP when things are fresh in your mind, so you'll be well. You'll be able to go and explain what's happened, your injury. You can also explain the issues that you're having or could potentially have, but you're saying it when you're well, so you can get that point across. You can tell them why you're there, what the impairment means to you, what's happened in the admission and how long you've been in hospital and things like that. So what does your GP need to know about you? Everything. So really it's your time to shine. Best to book a double appointment so that you're able to let them know how your spinal cord impairment has affected you. You want to be able to talk about your health issues that you might be having or have had in the hospital that might be an issue going forward. You want them to know about things that are really important to you for them to know, again, because you'll be well and you'll be able to articulate it properly. So you want them to know if you have bowel problems, bladder problems, if you have autonomic dysreflexia. It'd be really good for them to know what is that, what's your triggers for autonomic dysreflexia, how you can resolve it and what works for you, and when you know that you've got autonomic dysreflexia. If you have things like spasticity, it's also really good for them to know the medication that you might be on, the exercises that you need to do, and things that you know that if your spasms have got worse, that you know that possibly your body is trying to tell you something. You also be really good to speak to your GP about how much care you need at home, who is your carer, if it's private or if it's family or if it's through an agency. It's really good for your GP to know and possibly have some contacts that they may need to get in touch with if you can't get to the phone or speak to them or go in for an appointment. So you know your body the best, so it's really important for your GP to actually understand that. You know when something's not right. It's really good for you to gain that trust with your GP so that you know when you can speak to them and trust them that they know and you know that something might not be right. If you want to know that they're documenting things right, it's really important, again, gaining that trust, get a good relationship going with the GP. It means that when you go with an issue and they're writing things on the screen or whatever, it's really important that you know what they're writing. Have a look at the screen or ask them to repeat back what you've gone in with. This could be something like a pressure injury that you're wanting to report, and it's really important if this is part of your original impairment that is documented like that. It's your body, it's you that they're writing about and talking about. It's really important that you know what they're saying about you and it's documented right. Where can your GP find out more information would be the Back on Track book that the Spinal Trust have. You can bring your book in with them and ask them if they want a copy or tell them where you can buy a copy. Australian resources are also the Australian Health Toolkit as well as the Health Maintenance Toolkit. But also let your GP know that they can also do a referral to the spinal unit that you've come from. If there's just a few issues that are building up that you actually both can't quite sort out, then they'll be able to do a referral and they can get more information there as well. Anybody who has a GP also just don't particularly want to go to see their GP. So sometimes that's why I was mentioning before, if you go early enough and start gaining that respect and trust both ways, just being able to feel that you're actually being listened to and they're actually taking the time to listen to what you're saying. As mentioned before, it is your own body and you know when something's not right. So if you're going in with an issue, they should be able to tell, actually, you're not feeling right, there is something wrong. And being able to feel that you can talk to them and just, you know, sometimes it's just a few things that you've got building up, have them written down or have a support person with you and just make sure that you feel that you've been listened to and you've got your point across. Would you always have to see a GP? That's an interesting question, because maybe there is nurse practitioners or practice nurses within the GP practice that you'd be able to go and see. As mentioned before, you know your own body. If you feel you've got perhaps an infection brewing, or you know the symptoms of perhaps a urinary tract infection or the start of a pressure injury, you might be able to get an appointment with the nurse. The nurse might be able to, if it is a nurse practitioner, prescribe some antibiotics if you are going away that might be able to take just in case anything gets worse. Or they might be able to assess your skin, take the urine sample or any other sample that's needed and report back to the GP. So that's a really good question to ask if you are about to enrol in a GP practice. Also, things like accessibility within the practice. Also, are they open to having double appointments, because you might have a few issues that you want to go and see. There's lots of different options in GP practices now, so it's really good to find out what they offer completely, and if you're able to go there for perhaps smear tests and things like that, and if that's something that you can actually access when you go there, if that's something that you need to do.